Stan's given you a flavour of the findings that have come out of Whole System Demonstrator, and I just wanted to spend no more than 10 or 15 minutes really just telling you a little bit about the policy implications of that. Or to put it another way, what next and how do we get there, and why in the Department of Health, when we started seeing the emerging findings and discussions with Stan and his colleagues, we started thinking about ways of moving this forward in the way that we have. But I wanted to just, if you'll indulge me, some of you might have seen this before if you've listened to me previously, but I think we need to look at why we're doing some of this. And I think Stan finished off really nicely about you need to understand your outcomes. You need to understand why it is that we're trying to use the telehealth within a service environment before actually going headlong into doing this. So I think we need to start by looking at future needs. And we know that freedom and choice are going to become the norm. In fact, it's probably already there. People are expecting this. They're starting to make some decisions for themselves, wanting to be able to access care in a way which maybe our parents and grandparents had never even dreamed of. And that's because if you think about our own lives, we have the freedom to choose what we want. We decide where we shop. We look at the internet if we wish to and shop from there. We look at all the options that are open to us. And I think that's going to be the same in healthcare. And it's a really important, those last 2 points that I think are really important in the way that we've been thinking through some of the policy implications of this. As the young people who are growing up with technology move on in life and become the patients and decision makers, and dare I say it, in 20, 25 years' time, if there is a forum like this sitting in the King's Fund, it will be people who are currently in their 20s who have grown up with PCs and now the smartphone generation. And they're not going to be sat here saying to each other and staring into each other's eyes and thinking about this, why and how do we get technology into our healthcare system? It's just going to be normal. And I think fewer people are going to be expecting to go to the bricks and mortar, going to clinics, hospitals for all of their various different diagnostic tests. We don't do that in banking, we don't do that with insurance, we don't do that when we're looking to buy a car. So why are we doing it when we're looking for healthcare? And I wanted to just say what we thought about Whole System Demonstrator. What's it actually telling us? And I've just put down a few bullet points for me. I think Stan touched on this. A better quality of care, lower mortality rates and reduced admissions, they're all within reach. The numbers are there. And no doubt when people crawl all over the studies and the papers and the work that Stan and his colleagues have done, there'll be questions to be asked. People will want to know, how did you get to that? How did you get to the other? But actually, as Stan has pointed out, this is not only a highly complex study, but it's got a very good base behind it. The power calculations to get the numbers to make sure that we get the results so that we have confidence in those results. And I think the important thing for me is that you can get these lower admission rates. You can actually start to see people being able to be supported in an out-of-hospital environment where they actually want to be in the majority of the time. And I think it's important that it busts that myth about the low quality of life. When I saw those results originally and some of my colleagues looked at them, the first reaction was, oh, this isn't particularly great, is it? It doesn't show us an increase or an improvement in quality of life. But actually when you stop and think about it, that's not what we were actually looking for. What we were looking to do is prove that you do not get this lower quality of life, that people are going to have a less of an advantage. And what we've actually demonstrated is that you can get to where we want to be. People getting the care they want, a better quality of care, at a similar, or actually slightly better in one of those slides I noticed, better quality of life. So to me, it shows that there is an option and an opportunity. We know you can get cost benefits, but we know you can get those cost benefits at the right price point. We know that you will not get the return on investment if the price is high, and if you're doing this at low scale. If you're buying anything in low numbers, you're bound to end up spending more money on it. So it's something about how you address those price points. But more importantly, for me, the technology is not the answer. The answer is the service change. It's about how you devise an option for people and a way of working with health professionals. So it isn't just about buying technology, whatever that might be, whatever system you think is appropriate, having looked at the patient need, and then overlaying it into the existing approach. That will not work. So the messages were very clear for us. And I also like one of the slides Stan put up there about the way that people have been looking at this in terms of the refusers of the kit. But some of the messages below and underneath all of that data was that age is no barrier. People like this. Satisfaction levels are very high. So who's going to benefit from this type of technology? And again, Stan touched on that. We need to understand that. If anybody's going to develop a service enhanced by telehealth, you need to understand who the audience is, who you're going to be looking for. And I've just rehearsed a few messages there about the numbers of people with long-term conditions, for example. And that's my interest. We know there's upwards of 15.5 million getting on for 16 million over the next couple of years. We know that's how many people are living with a long-term condition in England. That's not to say that all of those people are going to benefit from the types of technology that are already out there. They might benefit from new technology, new ideas that are coming through, but what all of them will benefit from is a service which is designed around them based upon a personalised approach. So we know that. So what are we actually trying to do with these people? As you see there, they actually spend a lot of money in the system. They cost us 70% of the health and social care budget. So I think we need to think, how do we use that money to the best advantage and get the best outcomes for people? And I keep making the point about service needs. And that bottom point there is about personalising care. But it's about that generic long-term conditions model, the Kaiser pyramid that Stan put up there. And understanding about using your risk tools to find out who they are, and then stratifying them in terms of need and the types of response you want. And once you've done that, you can actually start to see what telehealth or telecare technology you need in order to make the difference. And I actually ask the question quite regularly, morally, can we ignore telehealth any longer? People have been working on this a lot longer than I have. I've met someone just recently who's been trying to get telehealth installed in a locality over the last 15 years and is really finding it difficult. We have got some evidence. There's the programme from the King's Fund has a number of abstracts and a number of studies in there over the years of the evidence base. As Stan said, a lot of that has been critical, or people have been critical over the years because of the size of the study or the length of time or the types of patients. WSD has tried to go beyond that. And I think we have got enough evidence, not just with Whole System Demonstrator, but with everything, to demonstrate that there is something about this technology. There is something about, if you use it, you will start to see reductions in some of the admissions rates, some of the mortality rates, some of the bed usages, and satisfaction rates, and indeed outcomes. So what we need to be doing is understanding how it will work better, but I don't think we can ignore it any longer. But the key to this is removing barriers and getting the services right. Not just going out and purchasing kit, not just thinking I'll have 10 of them, 100 of those. Thinking big, thinking about the numbers of people who really can benefit from this, to get those economies of scale, but also to get the outcomes that we need for the people who will benefit. And I just wanted to quickly put this, I'm not going to go through all of it because it would take quite a long time. But we started from the point of view of, well, what's stopping this happening? What are the barriers to delivery? And right in the middle is that evidence and business case. What is the evidence base? Does this hurt my patients or does this benefit my patients? Is exactly the right question. And we're starting to see more people now responding to the evidence and saying, well, actually, I think this is something we need to be looking at. And I hope Whole System Demonstrator will start to put that question to bed. But we do need to understand the business case. And the business case is not just from an economic point of view, but from a patient point of view. Is this the right thing for that particular patient? Do we have the right technology to respond to those people's needs? So I come back to the whole point of understanding the long-term conditions model. And then you have all of the other issues about raising awareness and getting the levers and incentives right. I actually believe that unless you tell people what it is that it is and it can do, then who's going to respond to anything? And telehealth is no different. If they don't know what it is, then how are they going to expect to use it or even ask for it? If professionals don't know what it is, how are they expected to respond to it and use it? And if we don't have the incentives in the system, and Stan touched on this, then why would anybody start to deliver care in a different way if all that's going to do is cause them more cost, or indeed drive savings into the arms of someone else? So there's something about how we get all of those business cases right and ready, which is why back in December we start talking about something called 3 million lives, and we did a formal launch in January at the House. And this is not a typical government campaign where we would go out, find some money, give it to people, have a lot of targets and say go off and deliver this. What we thought would work better is to think through some of those barriers to delivery. And it became obvious to me that we can't do this alone. Government can't formulate the answers to all those problems, but actually neither can the NHS and social care system. And actually neither can the industry, those people who are out there developing and delivering the solutions. People just can't do it alone. We need to work together. And I include patients and service users in that as well. So we wanted to work with everybody to come up with a solution which would not mandate a particular system or not even direct people into certain numbers, but actually said this is about service change. This is about transforming people's lives. So we've been working over the last few months with the various industry bodies and indeed some of the companies as well, and we've had various discussions, culminating really on the 19th of January with a concordat that was signed between the 4 trade bodies representing the telehealth, telecare industry and the government. And this was setting out our ambitions and our intentions to work together as one to deliver something which is about change. But to get there, I think we need 3 different things. We need to make sure there's a different business offering from industry. We need to understand that this isn't about selling 5, 10, 20, 30, 40, 1,000 boxes. This is about a different approach. This could be about a revenue stream. This could be about engaging with the health and social care world in a way which actually starts to bring a different opportunity for industry. Not a selling environment, but a service environment. But to do that, you need to have the health and social care family actually start to respond in a way which actually makes it worth their while. So we're working with all the various leaders in the NHS and social care to think through about, well, how do you respond to that? And some of that is, well, what are the problems with tariff? What are the problems with incentives in the system? Who is going to make the big difference? And one of the promises that we've made to industry is that we will work to help unblock some of that in order to make that transition happen. And I'm happy to say that the NHS Institute are working with us to find ways of providing support to the NHS so that they can understand the offers differently and respond in a way that will work. But more importantly, I think it's about health and social care saying to industry, you need to do this in a way which will help us, and vice versa. And the third element to this really is from the centre, from government. We've made a pledge that we will do what we can to help create that macro environment, to help this work, to create this movement, to help this along its way. And some of that's already happening. The work that Sir John Oldham is leading on embedding the generic model across the country for people with long-term conditions, that will create an environment for this type of service to be overlaid and become part of a whole piece rather than just a technology piece. But as I say, it's about improving 3 million lives over 5 years. People ask me, where do we get the 3 million from? Well, I'll tell you, we looked at the findings come out of Whole System Demonstrator. We looked at the type of people who are currently using the technology. We looked at the numbers of people with long-term conditions across the country. And we started to try and work out across that pyramid with the types of service offerings that are out there, how many people could potentially benefit. And we came up with that number of about 3 million. But that doesn't mean there is going to be definitely 3 million people only in the country who could benefit. There could be more. My personal view is that actually you've got 15.5 million people in England with a long-term condition. And of that 15.5 million people, very many of those will benefit from a different type of technology supported service which probably doesn't exist yet, but it will be developed as we start to get the scale that will make it important for people. But to get there, we need leaders. We need leaders who are not afraid to make change, people who are looking at this in a different way, share the vision, be able to move quickly on decisions, have that good project management skills. But more importantly, we need the professional leaders, we need the management leaders, and we need the financial leaders in the health and social care world, as well as in industry, to take this as it's meant to be, creating the movement, as I said, not being afraid to think through things differently, but look at the evidence, look at what it's telling us. This at a scale can make a big difference. And if we actually stopped and thought about it for a moment, one of the headlines that came out from Whole System Demonstrator was a 45% reduction in mortality. If I was stood here today from a pharmaceutical company and said, there's a box of pills, you give those to your patients and you'll reduce mortality at that sort of level, and I've got the robust evidence behind it to demonstrate that, you'd snap my hand off. So what is it about this that's stopping us doing it? And I think it is about a pragmatic willingness to look at things differently. And as Stan said, it's about getting the leadership right and people thinking about doing things in a different way. But it's not something which is going to be, I think, too scary, because we've actually got a model. We've been doing this for the last 5 or 6 years about trying to change the way that people with long-term conditions receive care, about personalising their opportunities. So it's about overlaying on that system the use of the technology to give it an additional boost. So I think, I'll go back to this slide I said at the beginning. Morally, can we afford to give this a miss? And I think from a moral point of view, from a health point of view, from a patient point of view, and actually from an economic point of view, this makes sense. And so we should be looking at how to do this at scale. We don't have all the answers yet, but the idea behind the 3 Million Lives campaign is really just to get to the point where everybody is focusing on this and finding the answers and seeing what we can do. It's what I think it's a once in a lifetime opportunity where everybody's coming together to look at how to improve care for outcome-based care for people with long-term conditions, about using the evidence-base to dismantle barriers and find those champions, build upon what people have already been doing. But let's not forget, and this is my take-home measure, it's about service change for people. It's not just about the technology. But what we do know now from the evidence is that if you use this technology, there is an opportunity to really give you a chance of getting those reductions in mortality and admissions rates. So I think that's all I really wanted to say in order to keep us on time. But I hope that's been helpful just to give you an idea of why we're thinking in terms of what the Whole System Demonstrator is about and why we're doing it. And if I could, I would just like to finish by talking about, just 2 seconds really, I'm going to hold it up, I don't often do this, but Innovation, Health and Wealth. It was a report that came out of the department again in December, and it sets out some of the high impact changes. There's 6 high impact changes, innovation changes, that if followed will make a difference in the system. And one of those is about 3 million lives and improving the lives of people using assistive technology. So we are committed to doing this. We've got it in the operating framework and we've got it in here. And another important issue with the high impact changes is sequence payments, and we've already said to get your sequence payments from 2013 we're expecting movement on those high impact changes. So around 3 million lives and technology we are expecting change, and we are expecting something to be done about this rather than it to continue to be a sideline. So I hope that's helped, and I'm happy to hand over to Chris and we'll start taking questions. Thank you.